This is a patient with an intumescent white cataract. We start this case with a triplanar corneal incision, barely nicking those limbal vessels, and we get a nice tunnel length here with good architecture. This surgery is being performed under topical anesthesia. Some trypan blue dye is injected and then washed out, and now a good amount of cohesive viscoelastic is used to really inflate and pressurize the anterior chamber. A key point in this surgery is to decompress the capsular bag. So before the beginning of the capsular axis, a 27 gauge needle is used to poke the anterior capsule and aspirate this fluid-filled cataract. This is a nice move to avoid the so-called Argentinian flag sign, which is a sudden rupture of the anterior capsule. We can see how this milky fluid comes out of the bag and is aspirated with the needle, so that the pressure inside the capsular bag is released without causing any accident. This milky fluid is really the hallmark of an intumescent white cataract. Using a ultrada forceps, we complete the axis, always paying attention in keeping the anterior chamber well formed and pressurized. Whenever needed, more viscoelastic is injected in the AC. This way, the pressures are balanced and the capsular axis won't run away. Once we are finished with our capsular axis, the nucleus is easily rotated. In such cases, not a whole lot of hydrodissection is needed, and this is certainly one of those free-floating nuclei. So here we go, buzzing with the phaco probe, with high vacuum, chopper goes around the equator, and we get a first chop. As there's almost no cortex or epinucleus around this cataract, it floats freely inside the capsular bag, and we must be very cautious in our chop maneuvers in order to avoid any damage to the posterior capsule. So we take our time here, debulking this nucleus. Using ultrasonic power modulation, the pieces are progressively emulsified. We can notice that it's quite a dense cataract. The visual acuity of this patient was hand motions. So imagine how delighted he will be after the surgery, when he gets a normal vision back. We are so lucky to have the opportunity to be part of such a miracle. This is really one of the most fulfilling parts of our profession. Finally, the remaining pieces are aspirated, the capsular bag is filled with viscoelastic, and now comes our single-piece acrylic IOL is sliding right inside the bag. The viscoelastic is now aspirated with the IA probe, the corneal incisions are hydrated, and now this intumescent white cataract surgery is concluded.